deductible plan, of which the city puts money in an HRA for you. They fund half your deductible. The employer is the only one who can put funds in the HRA. You also have the choice of those other two high deductible health plans that can be tied to an HSA. Those are individually owned trusts, and you can put funds in those as well as the city. If you think about an HSA, this is just kind of a picture of everything that's happening. You're on that qualified high deductible health plan, which makes you eligible to put money in a health savings account. You can use that health savings account to help pay large medical bills. You could pay COBRA premiums, dental and vision expenses. When you think about an HSA, when you put the money into that account, you're putting it in for the year. In this example, someone contributed $3,500. If you spend $500, you can take it out. Anything that's left rolls forward to the next year, and that account can continue to grow tax-free from year to year. This account is what we call a triple tax saving. As I mentioned, you can put the money in pre-tax through payroll. Any interest in there is growing tax-free, and you can withdraw the money tax-free for eligible expenses. So this year we're looking at kind of questions for you guys. See how you understand the HSAs. So here is Sam recently went to the doctor and his bill was $100. If Sam had the ability, can he pay the bill out of pocket in order to allow his HSA to continue to grow, but save his receipt and withdraw the $100 tax-free at any point in the future? And yes, all the nods that said yes, absolutely. What's really nice about an HSA is you can get it established, you can incur expenses, and you could reimburse yourself for those expenses 2 or 3 years down the line. So with an HSA, there are 2 sets of rules. First, how can you put money in? Are you eligible to do so? The next one is distributions. How do you get the money out, and for what expenses and for who? So if we take a look first at the HSA eligibility, the first thing is, are you on one of those $2,800 plans in 2020? If your answer is yes, let's go ahead and look at number 2. Are you covered by another non-high deductible health plan? And if you think about that, another non-high deductible health plan would be you're on your spouse's traditional plan and you're double covered. You or your spouse has a full FSA or an HRA that is not limited to dental and vision expenses, or perhaps you're on TRICARE. If any of those things apply, you would not be eligible to put money into an HSA. The next question to ask yourself is, are you enrolled in Medicare? If so, you would be ineligible to contribute to an HSA. And the last one is, are you a dependent on someone else's tax return? Now, if all those answers are no, you are eligible to contribute to an HSA. Taking a little closer look at that non-qualifying coverage, when I say non-high deductible health plan, that's those are funds that you can use to pay for medical expenses. So for example, dental or vision coverage on an account, whether it be a limited FSA or an HRA, that's fine. You can contribute to an HSA. You can have certain cancer policies or accident policies and still be eligible to contribute to an HRA. You cannot be covered by a full scope flexible spending account, and then think about those other things like TRICARE, Medicaid, and certain VA medical benefits may disqualify you from an HSA. So Joe is enrolled in a qualifying high deductible health plan through the city with single coverage. His wife Susie covers she and the kids under a copay plan, and the employer contributes $750 into the HRA for Susie and her family's medical expenses. Is Joe eligible to contribute to an HSA? Here you really have to think about it. So if Susie's HRA is only set up to allow for reimbursement of the members on her plan, then Joe would be able to contribute to an HSA. If that HRA was open to all family members, he would not be eligible to contribute to an HSA. So this is just kind of an example of learn about your spouse's coverage and what that looks like and how it may make you ineligible for an HSA. So the next thing are HSA distributions. How can we get that money out and who can we pay for? So you can use your HSA to pay expenses for yourself, your spouse, and tax dependents, even if they're not on your health plan. One thing I do always note here, because I have adult children, is remember you can cover children up to age 26 on your medical plan. However, if you have an HSA, they do need to be tax dependent for you to reimburse from your HSA. So here's another example. Mark is enrolled in a qualified high deductible health plan through the city, and he contributed $3,000 into his HSA for 2019. In 2020, he drops coverage from the city to enroll in his wife's $25 copay plan. Can Mark use his $3,000 balance to pay for he and his wife's medical expenses in 2020? And the answer is yes. Even though Mark is no longer enrolled in the qualified high deductible health plan and not contributing to an HSA, those funds are his to use to pay for eligible medical expenses for himself, his spouse, and his tax dependents. When you think about tax-free qualified expenses from an HSA, those are similar to what you can run through an HRA or an FSA. Those include prescription copays, chiropractic visits, your vision and dental expenses, prescribed over-the-counter medicines, and insurance premiums such as COBRA, long-term care, Medicare B, D, and Medicare Advantage premiums. Any questions on the qualified expenses? Okay, the nice thing about this HSA is it truly is your savings account. So you can withdraw money from your HSA for any expenses. They are subject to income tax and a 20% penalty if they're non-qualified expenses or not medical in nature. That penalty does not apply once the account holder becomes Medicare eligible, disabled, or due to the death of the account holder. So Tom, a current employee, is 66 and has $25,000 saved in his HSA. He has storm damage to his house and would like to take out $5,000 to cover costs. Is that allowed? And it is. Because he is over the age of 66, he would just be charged the income due on his qualified expense. One more pop quiz. Katie is enrolled in single coverage in 2019 with an HSA, and her husband Sam has a deductible plan coverage through his employer. Can Katie pay for Sam's qualified expenses from her HSA? And yes, there are different rules for the contributions. So in this case, she is, his spouse, and those distributions can be run through his HSA. I'm sorry, her HSA. His can be run through hers. Any questions on the HSA? The next one is the health reimbursement arrangement. That is the savings account that is being put in, the money is being put in the city for you. So if you have elected that $2,500, $5,000 deductible HR qualified plan, that makes you eligible for the contribution from the city, which is half the deductible. What can you run as expenses through an HRA and for who? This is more like a medical plan. So you can use your HRA to pay expenses for yourself, your spouse, and your dependents up to age 26. The expenses you can run through, as I mentioned earlier, very similar to an HSA. Your medical, your prescription, your vision, and your dental expenses. Remember, in HRA, you can run any post-employment premiums through an HRA once you leave the city's employ. Any questions on the HRA? Okay, the last savings vehicle we have is the flexible spending account. So remember, these are pre-tax accounts. You're making elections into these accounts during open enrollment, and they do hold throughout the full year for 2020 unless you have a status change. The first account is that dependent daycare account. So think of this account if you need to put away money to help pay for your daycare for your children or adult daycare. The limit on this account is $5,000 per family. The second account is a health FSA. You can use this money to pay for qualified expenses, including medical, vision, and dental expenses, and the IRS maximum is $2,700 that you could put into this account. The health FSA, when you have that account, when you elect those dollars, they are available to you the first day of the plan year because this is a use it or lose it account. If you're contributing to a medical FSA, full or limited, with a health savings account, if you are putting money into a health savings account, the only FSA account you would want to open, if you were interested, would be one that is limited to dental and vision expenses. That would protect your HSA to continue to grow, and you could run those limited expenses through it. If you're on the health reimbursement arrangement, or HRA as we call it, that FSA can be a full scope FSA. Any money you put in the FSA will automatically be used before your HRA dollars are touched. So that will allow your HRA dollars to grow over time. And remember, this FSA is a use it or lose it account. So any money you have in there, we would want your administrator to take those funds first for eligible medical expenses. There's a lot going on in these slides, and we've talked about a few things. So in that second row, if you take a look, how much can go into the account? So with the health savings account, that is a limit set by the IRS. And so in 2020, for those of you who have individual only coverage, you could put up to $3,550 in that account. If you have a family tier plan, you could put $7,100 in. And for those of you who may be over the age of 55, you can put an additional $1,000 in that account if you would like. Remember, the flexible spending account, again, is that use it or lose it account. Your limit is $2,700 on that account for 2020. Of the three accounts, please remember that the health savings account is, again, your savings account. It is the only one that you could run non-qualified expenses to. And as a reminder, if you did, they would be subject to tax on any distributions you take for a non-qualified expense and that 20% penalty. What happens when you leave the city's employee with each of these accounts? With the health savings account, that's a portable account. You own that account. If you would choose to move it to another institution, you could do that because it is your savings account. The health reimbursement arrangement, the money is always there for you to spend down. However, it will stay under the city's umbrella with their administrator, but just know those funds are always there for you to spend down. And the last one, that flexible spending account, that is not a portable account. And as I mentioned before, it's that use it or lose it. So when you know you have the expenses, that's when you put the money in for it. The expenses you could run through the account are those while you were an employee of the city. That's all I have. Is there any questions? Okay, I'm going to turn it over to Jamie.
Yep. All right, good morning everyone. My name is Jamie from Health Partners. I'm going to go over some of the tools and resources that are available to you as Health Partners members. A lot of what I will cover is review, and it is also in the booklets if you grabbed those when you walked in. All right, so Sue did cover your health plan information as far as what your benefits will look like, and there's no changes to those except for a couple of things that we had wanted to highlight that will be a little bit different for 1/1/2020. So the first two on the screen here are state of Minnesota mandate changes, and so they are required to be put in place by all health plans here in Minnesota. The first is an insulin cost sharing provision, and so what that means is that individuals who have any insulin that they are filling that is on the Health Partners formulary list, when they go to the pharmacy to have that medication filled, they will now pay no more than the net cost of that medication. So it's kind of a confusing concept, but what that would mean is that you will now pay our negotiated discount like you do today, less any manufacturer rebate tied to that medication. So because the cost of those insulin varies so much by each brand, as well as what the discount in the rebate is that's tied to each one. I don't have a great example of that, but I have been told that you will likely pay significantly less than you are today, especially on that HSA plan design. The second one is for treatment on a condition called PANDA or PANS, and it's an acronym that is a very long condition, which is pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So a very rare condition there, but it's quite serious. And so going forward, any treatments related to that condition will be covered under the plan design. The next two on the screen are Health Partners changes. So ovarian cancer screening tests, if they are done outside of an annual exam, they are now going to follow your office visit benefit or the diagnostic benefit. If they continue to be part of your annual exam, it will remain under the preventive care benefit and covered at 100%. Inpatient skilled nursing facility is a language change, so that is going from 120 days per confinement to 120 days per calendar year. And then the last one is an enhancement to that RX Plus plan. So if you have any chronic conditions and you are on that plan design, the IRS has expanded the list of things that can be covered pre-deductible, and that does include some labs, durable medical equipment, and some additional office visit services. So if you have any chronic conditions and you are on that plan design, I'm happy to talk through that with you after the meeting. Any questions on those things before we move on? All right, so because it's open enrollment, we like to remind everybody to make sure they are going in to the doctor at a minimum for their preventive care visit. So that's going to include your annual exam, any well child visits, cancer screenings, immunizations, eye exams, that type of thing, anything that is more so preventive in nature. At a minimum, we like to make sure that we're going in for those, because the earlier we go into the doctor's office and things are detected, it's going to result in a better health outcome for you, as well as the cost that is going to be associated to treat those conditions. So not only the cost coming out of your pocket to pay for your doctor visits and things, but as well as the cost to the plan, which in turn results in what's going to come out of your paychecks for premiums in the future. So encourage that, covered at 100% under all the plan designs. And then as a reminder, on the RX Plus plan, that $2,800 plan design you have to choose from here, they have preventive drugs covered at a copay, so prior to that deductible needing to be met. It is a $12 copayment for any medications that are generic, and a $45 copayment for any brand medications, and that preventive drug list is out on our website for you to take a look at. All right, a couple more things related to pharmacy. So again, no changes on this. You have our largest formulary list at Health Partners. It's called Preferred RX. So if you have any medications you're taking or newly prescribed and you'd like to see how they will be covered, you can go out to the website to take a look at that. All the medications will have different icons next to them, which will indicate how they are covered. So anything with a C next to it is a covered medication, or is on that Health Partners Preferred Drug List. Anything that indicates NF is a non-formulary medication, so while it's not on our preferred drug list, your plans still have coverage for those medications. And then NC is an excluded drug, and that would not be covered under the plan design. A couple of additional things. We always encourage individuals to take generics whenever possible. They are just as safe and effective as brand medications, but they cost significantly less. So if you are taking a brand medication, I encourage you to have that conversation with your doctor to see if there is an equivalent that you would be able to take and transition over to. I know it's not always possible, but it's always worth having that discussion with your physician. And then Health Partners has a drug cost calculator out on our website. So if you have medications you are filling on a maintenance basis, you can take a look out there to see what the cost of those medications are based upon which pharmacy you are filling them at. So if you are currently filling your medications at Walgreens, there may be some cost saving opportunities by transitioning that medication over to Cub, to Costco, to Walmart, even to CVS. So take a look at that, especially on those HSA plans. We want to keep some of those dollars in our pockets whenever possible. And again, we shop around for a lot of things in our lives, like groceries and gas and different things like that. We can certainly do the same with our healthcare. And a couple resources on the bottom. So we have pharmacy navigators within our call center, so they can answer questions on your pharmacy benefits. They can help you with a generic alternative if you are looking for one, and they can even help you with a drug coupon. If you have a really expensive medication you're taking, there might be some manufacturer coupons available to you. Meet with a Pharmacist is a program called Medication Therapy Management, or MTM, and it's a really nice resource for individuals who have more complex medical situations, or they have a number of medications that they're taking. They can set up an appointment with a pharmacist to meet with them one-on-one, either telephonically or in person, and go over the list of drugs that they're taking, as well as any over-the-counter medications. And then they're able to see if the medications they're taking are treating their condition the best it can, or if there are any interacting with one another. So all free programs covered under the plan design, and they are all confidential. And then lastly on pharmacy is our mail order pharmacy program. So if you are filling medications on a maintenance basis, you can certainly get those drugs sent to your home. You can get a 90-day supply for 2 co-payments on the HRA or under that preventive RX list, or perhaps a lower per unit cost on the HSA plans. So it's very easy to transition your medications. You just need to have that RX number on your bottle, and you can either go online to transfer it or give our mail order pharmacy a phone call. They turn drugs around in about 5 days or less, and it's located in Eden Prairie. So it's very easy, and they send it in a very generic looking envelope as well. All right, so the next thing I wanted to cover is our online plan comparison tool. It's called Plan for Me. So here at the city, you have 3 different plan designs to choose from, as well as 2 different networks. And so we want to make sure that every individual has the information available to them to make sure they're enrolled in the right plan based on the type of healthcare their family uses. To access this tool, you go to healthpartners.com/planforme. You're going to enter in the group number for the city, which is 5614. The site is all, and then the effective date is 1/1/20. It'll walk through a series of questions, so things like who's going to be covered under the plan, the age and genders of those individuals. You can enter in the clinics and doctors your family utilizes, so that'll be helpful as far as the network options. You can also enter in information on the medications your family takes. So again, that'll be helpful for the RX Plus plan. And then you'll also enter in what type of care your family uses in a given year. So if you have an idea of how many doctor visits you typically go in for, or if there's any scheduled surgeries, you can put that information in and it will take those services into account. Then you'll put in what is the premium that's going to come out of your paycheck per month to pay for the insurance. The very last screen you will see is going to show you side by side financially which plan is going to make sense for you and your family based on that care you had entered as far as what you guys utilize. So it's a nice way to have that peace of mind that you are on the right plan design based on the type of care you and your family use. Most often we enroll in the same plan each year because it's easy and it's what we're comfortable with and what we know, but oftentimes we can be overinsured for the type of care our family is using. So it's a nice way to have some of that peace of mind, but just because it says to enroll in plan XYZ, you certainly do not have to change plans if you don't want to. It's also a public site, so you can go over it at home with a spouse if you'd like, and nothing is saved out there. All right, as reminders, you guys have been Health Partners members for a number of years, but I hope everyone in here has created an account at healthpartners.com. If you have not, all you need to do is have your member number as well as your date of birth, and it will walk you through the various steps to get that account created. Once you have the account created, you can download our app. It's called MyHP, and you're going to have a lot of the same health plan information available to you on the go as you would on our desktop site. So a couple of things that I do like to point out. I know it's hard to see, but there on the left side, the bottom blue icon that's encircled there is your ID card. So if you are at the doctor's office or the pharmacy and you don't have your ID card in your wallet or your kid's ID cards, you can pull it up on your phone and you're able to fax it to the pharmacy or your doctor's office. The purple box towards the bottom is going to show you your deductible. So if you'd like to see where you're at as far as your plan balances for the year, that information is out there in real time, as well as the bottom icon there at this bottom of the screen says My Plan. You can click on that and that will take you into your plan information. You can see your claims. You can even pull up your explanation of benefits in a PDF format if you'd like. And you can also shop around for care. So if you want to see how much a doctor's office is at Alina versus Fairview versus Health Partners or Park Nicollet, you can do so on your phone and shop around for those medications like I just talked about. The next couple of things is just information on telemedicine. So as a reminder, we have Virtual. This is an online clinic available at Health Partners. It can treat up to 60 common conditions. So coughs, colds, sinus infections, pink eye, rashes, UTIs, that type of thing. That's pretty easily diagnosed and you just need to get a prescription and kind of be on your way for. To access it, you go to virtual.com. You'll enter in your symptoms, which will then get reviewed by a nurse practitioner, and they will follow up with you within 30 minutes with a treatment plan. If you do need a medication, they will send it to the pharmacy that you had designated at the beginning of the survey. So it's very easy to use, and if it cannot treat you, it will kick you out and say you need to go to the doctor's office, and then you do not get charged for that. The maximum cost is $49, so it's much cheaper than it would cost you to go into the doctor's office or even go into an urgent care facility. And then very similar to Virtual is Doctor on Demand, so that can treat similar items. However, this allows you to have a video chat option. So if you'd prefer to see your physician face-to-face, you can do so through this service and it will have a secure connection. The cost for this though is slightly more, it's $59, and it's also $59 every 15 minutes. So just keep that in mind if you're using that service. It does have a timer on the screen that will tick down as you're going through so that you're not caught off guard as far as that timer in the next $59 portion starts. A couple of additional resources as members. We have programs that are offering nurse support, so it's called Disease and Case Management, and they are for individuals with chronic conditions like diabetes, heart disease, COPD, asthma, depression. We also have some more targeted programs for cancer management, low back pain, and healthy pregnancy. And so we have about 150 nurses on staff at Health Partners, and they review claims as they come through. And if they are watching your claims activity and view that you might be eligible to work with a nurse and receive some additional support, they will give you a call. So if you get a call from Health Partners, they're calling because they want to help work with you and your care team and help you manage your condition the best you can. So if you get a call, again, we're not calling to be nosy and get in your business. We're really just calling to be supportive and helpful to you. So the nice thing with that is they'll make sure you're following your treatment plan from your doctor, you're taking your medications as prescribed, and they can also communicate with your care team. Because we are a care delivery system as well as an insurance company, our nurses have access to electronic medical records, and they're able to enter notes in the system to have that communication with your doctors and nurses, as well as read any notes that they might put in as well. This is a confidential program. It's also voluntary, and it's free, provided to you under the plan. And then to ensure we are supporting the whole person, we have some resiliency courses available to support your emotional health. So Beating the Blues is the first one on the screen there. It is there to help manage stress, depression, and anxiety, and teach you different skills to bounce back from some of life's challenges. There's 10 different modules within this program, and they are supposed to be just as effective as you would be going into have a one-on-one appointment with a psychiatrist. And then at the bottom of that is online courses. So we have 5 different topics there to focus on different things to teach you things to practice in your everyday life: healthy communication, healthy thinking, choose civility, find meaning and purpose, and then bring your best self to work. So a variety of different topics that we can all likely practice and work on. And then the last couple of things I have is just information on discounts. So as Health Partners members, you do get discounts on various health-related purchases. So anything from exercise equipment to healthy eating options, healthy mom and baby products, as well as some additional things like pet insurance, which is interesting. So I always think that's funny that a health insurance company has discounts on pet insurance, but it's a nice feature because our furry friends are just as much part of the family, right? So keep that in mind if you are purchasing those. The list is on our website, and the discounts do vary by retailer there. And then we'll continue the gym discount. So if you are working out 12 times or more per month, you would get that $20 reduction on your gym dues, and that does apply to 2 reimbursements per household per month. And then lastly is my Assist America program. So that is also part of our Healthy Discounts package. And this program is available for individuals when they are traveling 100 miles or more from home. And if something happens while they are traveling, such as forgetting a prescription or losing their luggage, or even if they need to receive medical care and they are out of the country, they can utilize Assist America, and that will help navigate some of those things for them. It's not travel insurance, so just keep that in mind, but it's really an assistance to help with some of those things that may come up while traveling. They do have an app you can download, and then there is an ID card specific to Health Partners. And again, this program is free as well, available to you. All right, I'm going to turn it over to John, but are there any questions for me before I do so? Yes?
Is that Assist America thing, is that for anyone on your plan?
It is for anyone that is covered under the plan design. Yep, thank you for asking that. Perfect. All right, John?
All right, thanks, Jamie. And as mentioned, I'm John Oakes from Integrity Employee Benefits. Good to be here again. I'm going to be walking through these benefits, the ancillary benefits, and not a lot of changes this year, so we'll walk through pretty quickly. Feel free to let me know if you have any questions. We'll talk about the dental insurance first, and it is still staying with the carrier Aetna. It is a 7.5% increase this year. You know, we shop that out every couple of years for you. We did switch to Aetna a couple of years ago, and this is the cap that they had on there. So they were looking for more, but you're capped at that 7.5%, so that's nice. Remember, you can go to any dentist you want to. However, you will save more money according to the plan design if you go in-network. And those in-network dentists can be found by going through your benefit hub and going to dental, and they have a nice link there. I don't know if you can see this or not, but if you go to participating dentist versus non-participating, you're definitely going to save more if you go in-network participating dentist. You can see there on the top there, the premium, $39.91 per month. Just remember that comes out pre-tax out of your check. So you really can subtract 25 to 30% off of that. Looks more like $30 a month you're paying to be in the employee-only dental option. As you look at the breakout there between participating and non-participating, the main differences are the preventative. It's covered at 100% if you go in-network, 80% if you go out-of-network, and then the basic services, 80 if you go in-network, 50 if you go out-of-network, and then the major services is 50% for both. The maximum is different for in-network. The maximum is $2,250. That's per person per year that the dental plan will pay out maximum. And then the out-of-network is $1,250 annual max per person per year. So you definitely want to try to go in network if possible. This is a broader breakout, and this you can find on your benefit hub with the summary that we have out there if you want to look more into the details. Just remember, this does not cover orthodontia for the dental plan. Here's a look at the link you can find if you go out in that benefit hub. There's some instructions there. The Aetna site is not super user-friendly, so we give you some step-by-step instructions of how to find that in-network dentist. Let's move on to the vision plan then. Similar to the dental plan, the vision plan is really there to help save you money. It's really about saving money on the things you'd go and buy. You can use your flex and your HSA dollars, but running it through either the dental or the vision plan, a lot of times it can save money. Now there is a trend increase of 5% with this. It's still staying with the same carrier, Avisus. There are no waiting periods, meaning you can use the full plan right away starting January 1st. And with the vision plan, you definitely want to go in network with that plan. That's where you're going to get the biggest savings. You see the premiums there, that $5.57 per month for employee only. You really can subtract 25 to 30% off of that as well. This comes out pre-tax out of your check. So it looks more like $5 a month to be in the vision plan. So with that, $60 net or so you're paying per year. You can go into an in-network provider, and every 24 months or every other year, you can go in and get new frames. And that's covered at 100% for the standard frame after a $10 copay each year. So it's going to be that standard frame at the in-network provider. If you want to go beyond the standard, value is usually about $130 to $150. You just pay the difference for that. Every year, you can go in and get new lenses for your glasses, and that's covered at 100% for the standard lens. That's single, bifocal, trifocal, lenticular. And in lieu of that, or instead of the glasses portion, you can go get contact lenses, and they'll give you up to $130 towards those contacts. Nice thing about the contacts is that is in or out of network. So if you go buy your contacts online, you can still take that receipt and submit that with a claim form and get up to $130 back each year per person on the plan. So you're paying about $60 net, you're getting about $130 to $200 value with this plan. Let's move on to the life insurance then. And Sue, I believe, mentioned a little bit about the life insurance, that Gallagher did take you through an RFP process this year, and through the Logis pool decided to stay with the same carrier you were at. So rates are staying the same. There's only one small change with the child life insurance that we'll go over. Basic life insurance is still at $35,000 for all eligible employees. And just remember, you can go up to $500,000 for employee, $250,000 for spouse, and then you can have the child life insurance. Now, health history is required for any increase for the employee or the spouse. So as you go through your system and make your elections, if you try to increase your employee or spouse life, it will pop up a health history form for you. So you need to fill that out and get approved. Now, the change with the life insurance this year, it's an enhancement that before there was a $5,000 option and a $10,000 option for child life insurance. This year, there's a $15,000 option and a $10,000 option. So that $5,000 option for child life is going away, but the nice thing is that there's an open enrollment opportunity. So with the change, you can add child life insurance with no health history. So take advantage of that this year and choose either the $10,000 or the $15,000 option. Let's move on to the short and long-term disability. So short and long-term disability are really there to protect your income. They're really insurance for your paycheck. Something were to happen to you, you couldn't come to work and do the job you do every day, whether that's because of an accident, illness, or maternity, that's where short and long-term disability may be your only source of income for a while. Now, I like to say that short-term disability is really for some, if you don't have a lot of sick leave and vacation time built up, and long-term disability really is for most. So looking at the short-term disability plan, this is the time of year to make some changes on that. This plan starts on the 15th calendar day if you have an accident, illness, or maternity, and can go up to 11 weeks. You can choose your benefit amounts with short-term disability, so you can go from $100 per week all the way up to 60% of your gross weekly income. Now, you can't go over $2,000 is the max for dollar-wise. Now, this time of year, you can change your short-term disability election. You can increase or you can join the plan for the first time. There are no health questions ever for short-term disability. However, there is a pre-existing condition applied. So let's say you bump up $200 this year or you join the plan for the first time. This pre-existing condition will apply to that new increase starting January 1st. It just says if that first year, if you have a claim on short-term disability, they'll look back and they'll see if you had a pre-existing condition that caused that claim. If you did, they won't be able to pay that increase for that specific circumstance, that pre-existing condition. It's still covering you for everything else, and once you've been in the plan for 12 months or more, then that pre-existing condition totally goes away. So just keep that in mind. With the short-term disability, they don't allow you to go over 100% of what you're originally making. They don't want to have you make more off on a disability than what you're originally making. So they do cap that at short-term disability plus sick leave, can't go over 100%. Moving on to the long-term disability then, nothing you need to do with this plan, just be aware that it's in place and it's a really great benefit that you have here. The city pays for this long-term disability for all eligible employees. Starts after 90 calendar days and it can go all the way to your Social Security retirement age. So age 65, 66, or 67. This plan pays 60% of your gross monthly income. It is capped at $8,500 per month. Any questions on any of those plans? Okay. Find more information on that Benefit Hub. A lot more information out there. And just remember, health questions are required for employee and spouse life insurance increases. I'll turn it over to Maddie. Thank you.
All right, we just have a couple more announcements here for you. So first, a reminder that you do need to go on and enroll for all of your benefits on Benefits Connect. Your username is going to be the first initial of your first name, your last name, and then the last four of your Social Security number. I'm sorry, that's your password. Your username is your email. You will want to step through every part of the open enrollment, even if you're not planning on making any changes. And then you'll want to make sure to re-elect your FSA and HSA contributions that you would like for 2020. And as John said, there's no changes to the long-term disability. Your sick leave accrual will stay at the 3.53 hours per pay period. The Health and Benefits Fair is coming up, so that will be on Thursday, November 7th here at City Hall in the Community Center from 9 to 11 a.m. We have some fun stuff planned, so try to make it to that. It does count as a health rewards credit if you attend. And then some other upcoming events. We are doing individual health plan consultations on Tuesday, November 5th. Those are from 1 to 4:30. If you would like to schedule one, just get in contact with me. We still have a lot of spots open, so let me know. And then lastly, your health rewards tracking cards are due to your department representative on December 6th or before. So keep in mind that in order to receive the health rewards credit for 2020, you do have to turn in your 2019 health rewards card. It's $100 per month for those enrolled in the city's medical plan, and then $50 per month for those of you who opt out. If you need a new tracking card, please let Tessa or myself know, and we will get you one. Any questions on anything? If not, thank you. We'll be up here to answer any questions that you have. Thank you for coming.